I'm Dr. Eric Ng from Hong Kong. I'm the Deputy Chief of Service of the Department of Medicine and Geriatrics in the United Christian Hospital, and I'm also the Director of the United Ambulatory Care Center. So in this European Health Management Association meeting, I'm presenting a session on a topic which I call ambulatory medical care and a successful bedside to boardroom collaborative model. Our hospital is like many other hospitals in the rest in the parts, every parts of the world, are facing rising healthcare demands. In our department, every day we have to admit 80 to 100 patients to our medical wards. So as you can imagine, this is already a very heavy healthcare demand. And what is more, a few years ago, back in the year 2006, there was a new challenge. And it was that at that time, there was a change in Hong Kong, so that there was a sudden surge in the demand for obstetric service. So much so that the government of Hong Kong decided that we need to create more beds for the obstetrics. But there was a problem in our hospital because all our beds have already been fully occupied. Every bed's already put to use for some purpose. So there was a challenge faced by the hospital administration, and they discussed with the medical department, because we are the largest department in the hospital. They asked whether we can convert some of the medical beds into obstetric beds. So this becomes our problem because we are already facing this huge demand. So at that time, there seems to be a tension between clinicians at the bedside taking care of patients, and on the other hand, senior administrators in the boardroom, they also have their own competing priorities. So during that period, I myself and my colleague, Dr. Ju, try to bridge this dilemma. Because we are consultants and we are also taking care of patients at bedsides, we found that some of the patients who are being admitted to the hospitals, they not necessarily require inpatient medical treatment, provided we provide a coordinated care to them to sort out their needs, and they don't need to stay in the hospital. So with this understanding, we deal with the hospital administrations that we convert some of our inpatient beds into an ambulatory service. So in the next few years, we went in this direction, and the results is very striking. We found that despite over the years, we still continue having rising admissions, say 20% of increase in emergency admissions. Yet our hospital beds, our beds in our department has reduced by 10%. But despite this, we can still maintain a reasonable hospital bed occupancy. And that's the total number of patients, the so-called inpatient bed day occupied, in fact reduced. So we found that this is a very good model. And the patients love it. When we talk with our patients, they found that now previously they have to undergo multiple stops to get their service done. But now we try to reorganize everything so that we try to deliver this one-stop service to the patients. Our passion or our goal is to provide the right service to the right patients at the right time and in the right place and through the right process by the right staff to give the good outcome to the patients. So in summary, we found a way that the frontline clinicians can communicate with senior administrators through senior clinicians to bridge the gap so that we can collaborate to improve patients' services in many innovative ways. Thank you.